Now, more Texas Business Radio
with Matt Register and Jay Curry.
Welcome back to the show, Texas Business Radio. TexasBusinessRadio.com is the website. I'm your host, Matt Register. Jay Curry is the one sitting over there in the co-host chair. We're going to talk a little bit about healthcare. As the owner of a business, providing healthcare is something that you have had to get intimately involved in, with the cost going up as fast as it is, and maybe you don't have the ability to give your employees healthcare, but the laws have changed. There's some very interesting new solutions, not even new solutions, but there's very this is a problem that almost universally across the business world that you have, and universally across families that you have. And there's some real smart folks out looking for solutions for you to be able to get you the coverage that you need, to be able to allow you to avoid massive financial hardships associated with that. So we have a very interesting company in the studio right now. Art Goetze is the CEO of Aliere.
Aliere.com.
Aliere.com.
Aliere.
There you go. Aliere. That does a cost sharing. This is a insurance model, right? This is a way to cover yourself for catastrophic type medical stuff, but it is not insurance. What do you think about this, Jay?
Yeah, this is revolutionary, and I'm kind of with you when you want to call it new. It's been around 30 years, but it is getting a lot. As you know, the medical industry, from the insurance side of it, is a disaster. I don't care which side of the street you're on, both sides are a disaster. This has been there all along. It's now getting up to the number of people to where it's becoming viable, and it's becoming well-known, and it's catching on, and everybody out there, if you're a CEO, you're a mom, you need to hear this.
Well, I'll tell you what, we talked about this during the break, and I think I have finally got my head wrapped around it. Art Goetze, CEO of Aliere. Welcome to the show, Art.
Thanks very much, Matt. Nice to be here.
So tell me about Aliere. What is it you do, and who do you do it to?
Well, the cool thing about our business is that just about everybody nowadays is suffering under the weight of healthcare costs.
Right.
Insurance is out of control, and they tricked us into thinking that insurance should pay for everything. But just like car insurance, it doesn't pay for wiper blades, oil changes, and things like that, replacement of tires. But then here we have health insurance. We expect it to do everything. And that's kind of a problem. So we left the insurance guys alone to run prices up, and nobody was watching the store. Meanwhile, in the Christian community, medical cost sharing took hold, and for the last 30 years, Christians have been sharing their medical expenses effectively and taking care of one another. And now that's made its way, like Jay just said, it's made its way into the commercial marketplace, where it's applicable now for small business owners who can't afford health insurance or who are struggling under the weight of what they're paying for health insurance. It's great for self-employed people who have, I call them micro-employers, all of us who are entrepreneurs and we have one or two people. We're not big enough for anybody, but you are for medical cost sharing.
Well, my wife is a real estate broker, right? Those are 1099 contractors. She doesn't actually have employees. She has a whole lot of contractors. Something like this is a prime or is a viable option for somebody like that.
It
right?
is. It's a perfect option for people like that. The challenge is for everybody, it takes a little getting used to. Medical cost sharing is not insurance, like you said earlier, and it's really different. It's instead of trusting a profit-minded Blue Cross, Aetna, or United, we trust in the community of people who are all paying in for each other's medical expenses when the time comes. It's sort of like GoFundMe in reverse. When it's my turn, the money's going to be there to take care of my medical expenses, and there's no limit on that. There's no caps, there's no limits, there's no network. Network, to me, the insurance guys, I think they kind of tricked us. Did they just not see the part where Google happened? Why do we have to have a network?
Well, okay, but one of the things I gathered out of our conversation during the break was one of the main components to this is the negotiations of rates, right? Is the negotiation of the actual payouts because I've been in a situation where I had to pay cash for healthcare before, right? My bill looked nothing like what an insurance company would have paid, right?
Isn't that the truth, right?
But a big component of this is they negotiate like an insurance company would, where they're not going to pay retail for a lot of these rates. but they actually pay the patient, and the patient pays the bill. They just don't pay it at the same rate they would if they walked in there by themselves. Is that accurate?
That's pretty right. One of the things I came up in the emergency medicine business, and I realized that I was paying 40 cents of every dollar just to get the dollar. That's kind of crazy. And so that's what's going on in healthcare. And every doctor out there has woken up to the idea that cash is better than waiting 9 months or 6 months and getting your brains beat in by some big insurance company to finally maybe someday get your money, right? No. So now when we flip the model, we're all cash pay patients in the medical cost sharing world. We just count on our medical cost sharing community to send us the money to do that. We're all responsible consumers of health care, and that's the secret sauce. And we have a partner who helped us manage those claims down. Sedera, our medical cost sharing partner, manages all the claims. We don't have to do anything.
So, as way of an example, okay, say I walk outside and get hit by a bus, right, and have a significant amount of ambulance ride, emergency room, surgery, recovery, all of that stuff, right?
Right.
This is I know you don't like using the insurance terms, right? But this is a initial out of pocket that I would have,
Correct. Right.
Not a deductible, but sounds a whole lot like a deductible to me, right? I mean, something like that. And then as the bills come in, the group now negotiates those rates, sends me the money, and I pay them 100% whole. I end up clean at the end of it, minus whatever I paid at the very beginning. Is that correct?
That's correct. Yeah. If you like.
Okay.
So the difference between that deductible that you wanted to say so bad, first of all, I feel sorry for that bus. You're a big guy.
There you go. I think the bus would win.
But we all at some point or another have heard of somebody who was in the hospital bed over New Year's Eve and woke up in the morning and had to pay their deductible again. That's kind of crazy. And
sure.
In our plan, the medical cost sharing world, you have an initial unshared portion, which is your cash out of pocket portion towards whatever incident it is. And an incident can go as long as it needs to go. So it could be a 2-year bout with cancer, and it's all one incident. So you have an initial unshared portion. And that typically on most people is somewhere between $500, which they can choose, either $500, $1,000, $1,500, whatever they're comfortable with. And obviously that the rates go down accordingly. But most people pick $500 because it's really comfortable. So the worst case is you get hit by that bus. Everything from the ambulance ride to the last day of physical therapy is going to cost you $500 out of pocket. And the worst case is if you, as an individual, have 3 of those in a year, the 4th one, you don't have to pay the $500 because I think the community feels bad for you.
You got other problems, right? But that just isn't one of them, right?
That's exactly right. So, this is ideal for those 1099 people who are making enough money to feed their family and put food on the table, but they're paying through the nose for health care. We typically save a family somewhere in the neighborhood of about $1,200 per month on their coverage cost, or actually there I am using the word coverage, and individuals, it's typically about half of what they're paying for insurance right now.
Interesting. And one thing that I gathered in our discussion during the break, it doesn't cover ongoing meds. However, it leaves you the money to go pay for those ongoing meds.
Yeah, that's a real good point. So it covers all the medications in conjunction with an incident. That bus accident, all the meds, anything recovered would have been part of the shareable amount. But if you have an ongoing issue where you have expensive medications, we can't bring that into the community because we try, just like pre-existing conditions, we have a burn-in period for those as well. So, we make sure that we're responsible and we don't just bring really, really sick people into the community and lower the waterline for everybody because everybody's counting on this community.
So this isn't for everybody, but it may be viable for you. So if you were the owner of a company, you guys come in and look at the employee pool and accept or deny them, right?
We don't accept or deny anybody. They're going to self-identify if they've got a bad pre-existing condition. It's surgical. I mean, they know they're going into surgery for whatever the heck it is they have. They're going to have to self-identify that, and that's going to be excluded. Everything else about them could be in the community and shareable. It would say if you had a bad back, that back would be excluded for that first year.
Interesting. All right. What's the easiest way for somebody to learn a little bit more about this if they have any interest?
Well, if they'd like to check their rates, it's real easy to just text us to 699. What's the number I put?
Okay. Text ACCESS, ACCESS to 61996.
That's it.
We're going to have this on TexasBusinessRadio.com as well. What is the website, real quick?
It's easy. Aliere.com. Aliere.
Aliere. Art Goetze, CEO of Aliere. Thank you very much for joining us. Unfortunately, we're completely out of time. We're going to go pay some of our own bills. We'll be back right on the other side of the break with a whole lot more Texas Business Radio. Don't go anywhere.
There's much more where that came from
at TexasBusinessRadio.com.
RREA Media has an exciting new product available to companies and organizations who are teaching classes and want to offer those classes online. Introducing Easy Distance Learning. Easy Distance Learning is a video-based distance learning system that allows companies and organizations to leverage their existing classroom content into a broader reach and increased revenues. Did you know that the rate of growth of distance learning is 10 times that of classroom education? And 66% of chief academic officers think distance learning is critical to their long-term strategy. Right now, 33% of higher education students are taking at least one online class. Companies and organizations not offering a distance alternative to in-class instruction risk being left behind. Video-based distance learning has three basic components: classroom capture, post-production, and content distribution. Easy Distance Learning is a comprehensive and modular system that covers all three components that can help your organization with what you are missing in offering a quality and convenient online learning experience. You choose the parts you need help with. Easy Distance Learning offers another revenue stream, a broader reach of your existing content, and a professional presentation with a great learner experience. Contact us today for a free estimate and see how Easy Distance Learning can take your company or organization to the next level.